Now, how do we select teeth for this treatment? There is a term called as risk-based sealant treatment. It means that caries risk has to be determined when deciding whether to use sealants or not. We have to consider the patient's prior caries experience, fluoride history, oral hygiene, and fissure anatomy. On the basis of caries risk assessment, we can judge if the primary teeth are at risk of developing caries and whether they would benefit from sealant application. So the indications of pit and fissure sealants are pits and fissures of permanent teeth in children and adolescents when the tooth or the patient is at risk of experiencing caries. Pits and fissures of deciduous teeth in children when the tooth or the patient is at an increased risk of experiencing caries. For example, if the child has deep retentive or stained pits and fissures with signs of decalcification, or if the child has caries or restorations in the contralateral primary molar or any other primary teeth. Sealing should be considered particularly for children and young people with medical, physical, or intellectual impairment. Next indication is non-cavitated carious lesions, meaning incipient carious lesion without any cavitation. Studies suggest that caries progression is slowed or arrested under sealants. Now, how does it happen? You see, when we place a sealant, we are blocking the bacterial nutritional supply. As in, we are taking away their food and trapping them in a place without any food, so they are obviously going to die. That's how sealants basically work. There are recent clinical trials too that suggest that carious lesions do not progress under well-sealed surfaces. That's why the American Academy of Pediatric Dentistry guidelines also support sealing occlusal non-cavitated early carious lesions in children and young adults. So we are placing sealants on incipient caries, but it's important to know that sealants are useful only when the caries are limited to enamel and have not progressed into the dentine, in which case removal of caries and restoration is indicated. So these are the contraindications: rampant caries or interproximal lesions and occlusal surface caries with involvement of the dentine. All of these would require restoration. Let's move on to the technique of sealant application. The first step is surface cleaning. The pits and fissures should be clean and free of excess moisture for good retention of the sealant, but the method of cleaning is a bit controversial. Some authors have suggested using pumice or air polishing instruments to clean the pits and fissures before acid etching. At the same time, others believe that acid etching alone is sufficient for surface cleaning. There's also another school of thought which says that when pumice or aluminum oxide is used, particulate matter is left in the deep recesses of the pits. How it impacts the sealant placement is not yet determined. Next important step is isolation. Moisture control is the most crucial aspect of the pit and fissure sealant placement. So absolute isolation using a rubber dam is preferred. What will happen if we don't take care of the moisture control? We etch the enamel and it forms microporosities, right? The resin-based sealant is supposed to penetrate into these porosities, but if the enamel porosities formed during etching are filled by any other fluid, it will block the resin tags, decreasing the retention of the material. Also, what happens because of salivary contamination is there is precipitation of glycoproteins onto the enamel surface. This greatly decreases the bond strength to the fissure sealant. That's why the application of glass ionomer may be considered as a transitional sealant when we cannot isolate properly. Next is acid etching. Why is it done? To create microporosities in the enamel surface so that when we apply a low viscosity resin, it penetrates the roughened surface. When curing is done, this will produce a mechanical lock of resin tags. Generally, concentrations of 30 to 50% phosphoric acid solutions or gels are recommended. Most frequently used is 37%. This gel is applied either directly with special applicator tips or with a small disposable brush or cotton pellet. It should be applied widely so that we don't miss any area. So it is applied on all susceptible pits and fissures and extended up to cuspal inclines. Now, is the etching time important? Actually, a study showed no significant difference in retention of the sealant when 15, 30, 45 or 60-second etching times were used. So different etching times have been given in different textbooks, but generally a 20-second etching time is recommended. If a tooth has dental fluorosis, it will require additional etching time. Next step is washing and drying. The tooth is irrigated with water for about 30 seconds and then dried with uncontaminated compressed air for 15 seconds. After this, the dry etched enamel will give a characteristic frosty appearance. Next step after washing and drying is sealant placement and curing. Many sealant kits have their own dispensers and instructions that must be followed. So the sealant is applied according to the manufacturer's instructions. Generally in mandibular teeth, the sealant is applied from the distal aspect and we should allow it to flow mesially. In maxillary teeth, it is applied from the mesial aspect, allowing it to flow distally. Using a fine brush or mini sponge, the sealant material is applied up to the cuspal inclines. We have to take care that air bubbles are not incorporated. After curing the sealant and before removal of the isolation material, we should examine the sealant for any voids, bubbles or deficient material. Retention of the sealant should also be checked using the explorer in an attempt to remove the sealant. If the sealant is dislodged, then the tooth should be re-etched and a new sealant material should be applied. In the end, we should evaluate the occlusion of the sealed tooth surfaces. This is done using an articulating paper, and if there is any excess, then it can be removed using a small round burr at slow speed. Last but not the least, follow-up is very important because it is estimated that between 5 to 10% of sealants need to be repaired or replaced yearly. I hope you liked this video, and if you haven't already, please subscribe to the channel so that you will be notified when I upload a new video. And I'll see you very soon. Bye.